Okay, we have an order to do an IV piggyback of Zosyn. So we're going to check our order. We have an order of Zosyn, 4.5 grams, IV piggyback, and 150 milliliters of normal saline to infuse over 4 hours. The drop factor is 10 drops per milliliter. Calculate the flow rate in milliliters per hour and in drops per minute. So in milliliters per hour, we're going to have 38 milliliters over an hour. Or it's going to be equals 38 milliliters over an hour. And then for the drops per minute, we have 6 drops, which is what we're going to be using. Since we're not using a pump, we are doing gravity. And the milliliters per hour, is what we would use for a pump. So we're going to use 6 drops per minute. Okay, so we're going to check to see if that is compatible with our normal saline that is already running as a primary in our room. Okay. Okay, so our Zosyn is compatible with normal saline that is running as a primary in the room already. So we are good to go. Okay, so I have my medication bag. This is Zosyn. It is the right medication. It is in date. It is not cloudy, no leaks. It is pre-distilled, pre-packaged, and pre-labeled. And then we have our secondary tubing, our gloves, and our alcohol pads. So now we are safe to go into the room. So I'm going to knock on the door, come in, hand hygiene. I'm going to introduce myself to the patient. I'm going to have 2 identifiers. This is the correct patient, so I'm going to explain the procedure. Okay, we're going to be giving you an IV piggyback of Zosyn today. Okay, so I'm going to assess the site first to see if it is good. And there's no phlebitis, no irritation, so we are safe. Okay, so I'm going to go ahead and spike my bag. So I'm going to put on gloves first, and then I'm going to spike the bag. Okay, I have my gloves on, so we are going to spike the bag. So I'm going to get my secondary tubing, make sure it's cleaned. It is. Okay, so I'm going to do this and stay sterile because you don't want to contaminate the patient by no means. So you're going to take that off, take the top off your spike, and then you're going to spike the bag. Okay, and it is all clamped so you can put it back. We're just going to sit it right here for just a minute. Okay, and now we are going to clean the distal site. My alcohol pads. Use friction to clean. Okay, and that is clean. So now we can attach this, keeping it sterile. Okay, and it is attached. We do not want to waste any of our antibiotic, so we are going to backflow to prime our tubing. And how you're going to do that, you're going to unclamp this until all the bubbles are out. Okay, and that's all the bubbles, so we're going to clamp it back off. And we're going to hang this back up here, and since it is a piggyback, we're going to drop this lower, our primary lower than our piggyback. Okay, and now I will readjust the flow rate of each line, make sure it's right, and we will be doing our 6 drops per minute, so I will readjust it to 6 drops per minute. Okay, and now I'm going to assess the site again to make sure that there's no phlebitis and make sure the patient is handling the fluid well, and she is. So now we are going to clean up, have everything put away. We're going to take off our gloves. We're going to perform hand hygiene and document.